Welcome you all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about coagulants. So first we'll see what is coagulants. The factors which are helpful in formation of coagulation or clotting is known as coagulants. What are those? Vitamin K, factor 8, factor 9, 1 Willebrand factor, cryoprecipitate antihemophilic factor, desmopressin, aminocarporic acid, tranexamic acid, aprotinin, rutin and ethamsalate. Okay. Among these, vitamin K and this aminocarporic acid, tranexamic acid are very important coagulants. In this, fat soluble vitamin is vitamin K. This aminocarporic acid and tranexamic acid both are antifibrinolytic drugs. They will also act as a coagulants. Okay. So we'll see vitamin K in following slide. So first important in this group is vitamin K. It has three subtypes: vitamin K1, vitamin K2, vitamin K3. Vitamin K dependent clotting factors are 2, 7, 9 and 10. Vitamin K is a fat soluble vitamin. It is found in liver and leafy vegetables produced by the colonic bacteria. Okay. So first we will discuss each one. Vitamin K1 is also known as phytonadione. They may ask the name. Okay. Which of the following is a phytonadione? Vitamin K1 is a phytonadione. It is obtained from leafy vegetables. It may give our oral or IV route form. For absorption of vitamin K1, bile salts will be needed. So those patients will doesn't produce bile salts. That means obstructive jaundice patients, they doesn't have bile salts in the gut. So there will be no absorption of vitamin K1 from the gut, leads to vitamin K deficiency. Okay. So in those patients will have obstructive jaundice, will not use vitamin K1, that is phytonadione. Okay. Good. Next. So next group is vitamin K2, also known as menaquinone. Okay, it is synthesized by intestinal bacterial flora. Okay, for synthesis of vitamin K2, intestinal bacterial flora is needed. Okay, so when the patient is on antibiotic therapy, so that means when patient is having a long antibiotic therapy, this antibiotic will destroy the intestinal flora. Therefore, thereby what will happen? Obviously, the synthesis of vitamin K2 will be lost. So obviously leads to deficiency of vitamin K2. Okay. So those patients on prolonged antibiotic therapy, they will not able to produce vitamin K2. So we can give supplement as vitamin K2. Okay. Next is vitamin K3. Vitamin K3 is also known as menadione. It is a synthetic analog. It is water soluble. Rest of two are not water soluble. These are water soluble. Vitamin K3, it doesn't need bile salts for their absorption. Okay. Vitamin K1, it needed bile salts for their absorption, but vitamin K3, we can't, then doesn't need bile salts for their absorption. So it may be useful in obstructive jaundice patient. Okay. So now coming to the therapeutic uses of vitamin K. So first of all, on prolonged antibiotic use therapy use patients, we can use vitamin K because vitamin K2 will be produced from the gut flora. When prolonged use, obviously it will destroy colony bacteria, so we have to replace by giving vitamin K. Next is overdose of oral anticoagulants will lead to cause. Obviously, our anticoagulants will lead to cause what happen when bleeding tendency will be more. So we have to give these drugs to control bleeding. Next is newborns and premature infants. Next, malabsorption syndrome and obstructive jaundice. The dose should be 50 to 100 micrograms per day. Okay. In this vitamin K, the main thing is vitamin K1 name, K2 name, K3 name. Vitamin K1 obstructive jaundice is not indicated. So vitamin K2, prolonged antibiotics patient, they doesn't produce vitamin K2. So in those patients, we will use vitamin K. Next, most important is vitamin K3 is main indication for all these things because obstructive jaundice, they doesn't need bile salts for absorption, so we can go with the obstructive jaundice patients. Okay, that is the MCQs mostly repeated in this topic. Okay.